Another thing was learning the simple question, what does a good day look like at home? Because we're actually seeing their child sick. I mean, who wants to be evaluated on their worst day? You're having the worst day of your life, and somebody's like, you don't have a good quality of life. What would you? You're sick. So I know that prior to coming back to do and I used to do follow up because I'm so, people say I'm too attached, but I love following the journey of families. But even when I was doing NICU follow up, I never asked people what a good day was like at home. And so I did not have that question in my toolbox before that. And just having somebody tell me what a good day is like at home, for a child who I may not be able to communicate with, or a child who's been in the hospital enough to know, you're not a friend. You're going to do something to me, and I'm not, so just learning from the families, what are they like, and trying to model that. And so I actually did a lecture yesterday for students about taking care of children, residents about taking care of children with complex healthcare needs. And I just had 4 pictures on it. And there were pictures of things people had described to me was a good day. And one of those was a picture of a red bird tapping outside of a glass window. And one of the things a parent had shared to us was her child was visually impaired and nonverbal. And she said the best part of her child's day, she said, I know you guys see my child and you think my child cannot interact with you. I know you just see secretions, you see coughing. She said, but the best part of my child's day is when I get to push her to the window every day. She said, there's a bird that comes every day and taps on the window. She said her child smiles when she hears the tapping. And I just thought, oh my gosh, how magical that is. So I had a picture of that. I had the movie Encanto. We had a family that was Spanish speaking only. We had a lot of difficulty trying to commute some of the complexities of their child's care. And the grandmother kept trying to pull up that movie like on her phone because the child was very agitated. And we're trying to go through our symptom history. What meds do you need? And she was trying to get us to understand if y'all could just get this movie on, we will all be good. And we finally figured that out. And the child immediately calmed. So that was really, really helpful because a lot of our kids with mitochondrial disorders or neuropathies, they may be nonverbal or cognitively impaired, but they have developed a way to communicate with their families. And we need to ask their families that because we cannot make that judgment on their worst day when they're sick. So I know I didn't have that in my arsenal before, just asking families, what does a good day look like for you? Because my definition of a good day may be very different from theirs. And then I had a picture of a child standing at the window waiting for the school bus to come back because the best part of the day was when their siblings would come back from the school bus. So they will wait for the school bus and get really excited. So just giving people a window to this patient is not this is not the kid with T18. This is not the kid with, they have a name, like they're part of a family. And the best way to figure out how we're going to get them back to wherever the family would like us to get them to is to learn what that is. And it can't be based on our biases for how they look on their worst day.